All right, as we continue our series for Heart Health Month, we're going to take a look at how age, gender, ethnicity, and more can impact your personal heart health. So joining us now, we have the experts here in the state, Dr. John Forrest. He is the interventional cardiologist at Yale-New Haven Hospital, along with Dr. Umer Darr, a cardiac surgeon at Yale-New Haven and Bridgeport Hospitals, along with Dr. Keith Churchwell, the VP and Executive Director of Heart and Vascular Center at Yale-New Haven Hospital. And I think you guys just set the record for the longest sublines there to your name. So congratulations.
Thank you. Appreciate it.
Cheers to that.
Thank you.
So we're talking all about ethnicity, age. How do those things factor into your overall health?
Well, when we talk about ethnicity, across the country, we know that cardiovascular disease is the major killer for Americans across all ethnic lines. We also know that if you take the African American population, especially both men and particularly women, it is the most common killer for African American women in this country, both cardiovascular disease and stroke. And one of the things that we've been trying to concentrate on, especially over the past 5 years, is looking towards what therapies are going to be the most capable in terms of decreasing the incidences of these particular events in the population.
And ethnicity is so important in this case. Also, age is another thing. So can we talk a little bit about
No,
how
absolutely. You know, at different ages, different heart diseases affect patients. You have pediatric patients. You have patients in their middle age where really coronary disease becomes a big thing. That's when patients present with heart attacks. And as we get older, incidents of atrial fibrillation, valvular heart disease become much more frequent. And so really you're looking at a patient from all of these different factors, their ethnicity, their age, their gender, and their background, where they were born, what they've been accustomed to in their life. It all plays a role.
Yeah, how does that come into play here, Dr. Darr, in terms of your family history? Because it's so important to look back through time, your parents, your grandparents, to see what their heart health is like.
Absolutely. We all have different genetic makeup, and what we have to realize is that we can't change who our parents and grandparents are. Mm-hmm. So we have to focus on risk factors in heart disease that are modifiable, which is why doctors get so upset about cholesterol profiles and smoking habits and control of diabetes and high blood pressure. Otherwise, if we could all modify our genes, we'd never get heart disease. So I think a better way of thinking about these factors is that if you're careful about your habits, and even if you're genetically predisposed to heart disease, you can delay the onset of heart disease by having good habits.
And some of those good habits, Dr. Churchwell, can you touch upon maybe 3 quick things that everybody at home can do simply and easily to improve?
So we always talk about what you can control. What you control is actually your diet. Diet is incredibly important in regards to controlling your blood sugar and also helping to control your cholesterol. You can control the amount of exercise that we do. We always say we don't want you to do something that you're not going to do on a regular basis, but do something that you can do, like walking or jogging or bicycling, something you like to do and you can do on a regular basis. Those are really the 2 things that you have a lot of control over. And the third thing is take your medication. If you have a difficulty with it, let your physician or provider know. But taking your medications is key in terms of controlling these issues.
Now, if it gets to the point where you may need heart surgery, there's actually new things that you guys have to offer here. This is really interesting, Doctor. Can you touch upon what this model is and how it's simplifying things for patients in terms of recovery time?
Certainly, we've made a lot of progress really in the last 10 years with how we treat complex patients with heart disease, from both coronary artery disease to valvular heart disease. And what you have here in this model is a simple model of the heart, and you have here the right side of the heart and the left side of the heart, and you can see different valvular structures here. And the way that we used to replace heart valves required open heart surgery, but now we're actually able to avoid open heart surgery and have patients' heart valves replaced by going through the artery of their leg using a catheter, which you see here, which has a balloon on it, and we can then deploy a valve, which you see here, into the heart. And so this is not for everybody, but this is for patients who otherwise might be too high risk to have open heart surgery. Right. And we do this as a team approach. So Dr. Darr is a cardiothoracic surgeon, and I'm an interventional cardiologist. And really what we've learned and what the guidelines have suggested over the past 5 years is that patients need to be seen not by a single practitioner, but by a heart team that together together with
Yeah.
the patient can make the best decision for them, or help the patient know what their options are,
Yeah.
and then let them make the decision from there.
The more people you have on your team, the better. The more assets you have, so guys like you can come in and offer different things to patients. Doctors, thank you so much for joining us here today on CT Style. We appreciate our friends from Yale-New Haven Health
you.
always coming here on the show. For more information about staying heart healthy, all you have to do is log on to ynhhs.org/smarthearts. Fellas, thank you so much for joining us here
you.
today on the show. And there's more to come. Up next, we're going to take you